This past Tuesday, March 27th, I had the privilege of attending oral argument at the Supreme Court on the constitutionality of the Affordable Care Act. And that morning, I saw and I heard the clash of two different views of what makes a good society. On one side were the attorneys opposing the law and the conservative justices who made it clear that in their view, the government cannot require people to purchase health insurance even if they can afford it. Why? If the law can require people to buy health insurance, might it not also require them to buy a car or a cell phone? One of the justices darkly suggested that the government might go on and require people to purchase broccoli. A veiled reference, some thought, to President Barack Obama. On the other side, defending the law, stood the Solicitor General of the United States, Donald Verrilli, who maintained that health care is different. The sellers of cars and cell phones and broccoli never have any obligation to provide those things for free. But in the case of health care, the uninsured can go into the market, and very often they can get taken care of because, as the Solicitor General said, of social norms to which we have obligated ourselves. It was at that point that Justice Scalia interrupted and said, and I quote, "So don't obligate yourself. Don't obligate yourself to providing that care." The Solicitor General was, I think, taken aback. And he said, I can't imagine the Constitution would require Congress to ignore this deeply held social ethic. And it's not just a social ethic that leads to providers giving care for free. A federal law actually requires hospitals to provide emergency care regardless of whether the people involved can pay for it. You see, the Solicitor General was saying that free care adds up. It adds to the bills of patients who do pay. It adds to the cost of health insurance. In fact, it adds about $1,000 a year to a family's cost for health insurance. That cost gets transferred into interstate commerce, and under the Constitution, Congress has authority to regulate interstate commerce, and the Solicitor General was saying, therefore, the Congress could set a minimum standard for health insurance. Now, the justices were looking for a limiting principle, but clearly cars and cell phones and broccoli are not like that. As much as you might like to go to the supermarket and say, I am experiencing a broccoli emergency, the supermarket doesn't have to give you any. As much as you'd like to go to an electronics store and say, I am having a texting emergency with my friends, the electronics store does not have to give you a free cell phone. But healthcare is different. The providers have a professional ethic. There are laws. There are obligations to give care to people sick and suffering. But Justice Scalia is right. Justice Scalia is right. If the providers don't recognize these obligations, if they don't provide that free care, there won't be those unpaid bills. That's the solution, right? Why didn't Congress think about that? That could have solved the whole thing. Hospitals could just let the injured bleed to death. They could turn away the contagiously ill, let them walk back out and infect other people. Well, maybe a good society shouldn't do that. Maybe even a self-interested society shouldn't do that if it has a modicum of intelligence. Now, these different views of a good society came out in other exchanges on Tuesday. Chief Justice Roberts pointed out that under the law, the minimum required coverage includes maternity, newborn, and pediatric services, and not everybody is going to need those. One of the other justices expressed concern that healthy young men were going to be asked to pay for things they do not need. And it's true. If you take a snapshot of a man in the prime of life, he will certainly not at that moment need maternity, newborn, or pediatric care. But if you think of a moving picture of that man's life, things look different. On the day he was born, his mother needed maternity care. He needed newborn care. He very soon needed pediatric services. And because women don't get pregnant all by themselves, I think it's fair to say that men are responsible for the cost of half the maternity, newborn, and pediatric services in the country. But Chief Justice Roberts is right. We could say that just as men shouldn't be obligated to pay for maternity care, women should not be obligated to pay for the treatment of prostate cancer. We could go through all the services and divide them up by gender. We could say that old people shouldn't pay for young people's medical problems and vice versa. We could say that black people shouldn't pay for white people and white people shouldn't pay for black people. We could do that. We could say each individual should just pay for the risk that he or she represents as part of the groups with which he or she can be associated. Well, there actually is a name for that conception of fairness. That's actuarial fairness. And under that conception, people with chronic illnesses or other serious pre-existing medical conditions are going to be quoted very high prices for insurance. Many of them will not be able to afford that insurance, but actuarially, that's fair. Of course, that was exactly one of the reasons for this legislation, the Affordable Care Act. And that legislation embodies a different conception of fairness. In fact, it's the phrase that's used in the law repeatedly. It's the principle of shared responsibility. The idea that any of us who may be healthy at one moment may be diagnosed with a serious problem the next. And so, though we may feel invincible and not need health insurance, we are at any moment right on the doorstep of the healthcare market and not completely outside it, as the opponents of the law contend. This argument about different conceptions of fairness is not the first time Americans have been bitterly divided about healthcare. In fact, it's one of the striking things about our history. The United States stands out in healthcare not only because we have some 50 million people without health insurance, and not only because we have the highest costs of healthcare any place in the world by far. No, we also stand out for another reason. We've been fighting about this issue. We've been at each other's throats over this issue for 100 years. In none of the other rich democracies in the world is healthcare such a flashpoint of ideological conflict as it is in the United States. Conservative parties elsewhere accept the idea of a shared responsibility for the costs of illness. That is not a controversial matter in most of those countries. It's only in the United States that conservatives have come to view healthcare very differently, have come to equate public responsibility or shared responsibility with a loss of freedom. That's a distinctive phenomenon in the United States. How did this conflict develop? How did it take the shape that it has? That's the subject of a new book of mine called Remedy and Reaction: The Peculiar American Struggle Over Healthcare Reform. It's not the case that Americans have these disputes and divisions in every sphere. Consider education. We have public schools. We have a kind of shared responsibility for primary and secondary education. You don't hear people talking about public education as socialized education. You don't hear that phrase, socialized education. Of course, we have public schools because back in the 19th century, we created them. Many Americans were concerned back then about how in a democracy we needed schools in order to have educated citizens. They were concerned also about Americanizing immigrants, and they saw the schools as a way to build the nation. I'm not sure in today's ideological climate, if we didn't have that legacy from the past, I'm not sure we'd get public schools today, but we have them, and that's part of the point. History passes things to us. It passes institutions to us. It passes ways of thinking about problems to us. And in the case of healthcare, we have a very mixed legacy from the past. The way this issue unfolded in the first half of the 20th century left a very peculiar legacy in the United States. The opponents of public programs for health insurance identified this idea, socialized medicine, with insidious foreign ideas, identified it with enemy regimes. At the time of World War I, that was Germany. Later on, it was the Soviet Union. In each case, the idea was that this was the entering wedge of foreign socialist ideas into the United States. And the success that the opponents had in that period kind of took the United States off the main track of development that other countries followed in healthcare. And so we adopted a series of partial policies in healthcare. We created a system for veterans. We provided employees a very generous tax subsidy if they got coverage from their employers. We passed the Medicare and Medicaid programs in 1965 that cover seniors and some of the poor. And in that process, we ensnared ourselves in what I call the American health policy trap. Well, the trap was we did protect the majority of people, the best organized groups in the society. And in some ways, these programs were very generous. They were very generous to the healthcare industry. They channeled an increasing portion of national resources into healthcare. They tremendously enriched the industry. These programs also actually obscured a lot of the costs. People don't see those costs clearly. That's partly what allowed them to grow as high as they have grown. And then finally, they gave many people moral arguments that they had earned their health care. The veterans, the employees who got it through work, and the seniors who got it through all their working years. They had earned their health care. They were entitled to it. Can't be taken away. And many of them said, I don't see why I should be taxed to pay for anybody else, for people who haven't earned their health care. And so the argument over health care has taken on this rancor and vehemence, which is so distinctive in the United States from other countries. Now, I'm not saying this trap was absolute, that we could never get out of it. In the early 1970s, we almost did when Richard Nixon was president. At that time, Senator Kennedy was proposing a single federal health insurance plan. And President Nixon said, well, we can't do it that way. That'd be too much government. Let's have an employer mandate, require employers to pay for private insurance. That's the private sector-oriented way to do it. I think if Nixon had only been wounded instead of destroyed by Watergate, we might well have had some kind of national health insurance plan in 1974. It's possible. But that moment was lost, and year by year, decade by decade, the costs have grown, the number of the uninsured has grown, the battles have become bitterer and bitterer. Fast forward to the 1970s, President Clinton said, I worked in the White House at that time, okay, let's go with an employer mandate. We'll have an employer mandate and private insurance as a way to get to universal coverage. Republicans said, no, that's too much government. Let's have an individual mandate. That was the Republican proposal in the early 1990s. And in fact, for almost 20 years, Republicans said the individual mandate was a good idea. Many prominent conservatives and Republican politicians whose names you know, including Mitt Romney, stood for an individual mandate. And of course, Governor Romney carried that out in Massachusetts. And finally, Democrats said, okay, you wouldn't do it these other ways. We'll do it your way. We'll do it with an individual mandate and tax credits and private insurance. And now what's happened? Oh, it turns out that this idea, which so many conservatives had so fully endorsed, has become a threat to liberty. What was once the embodiment of individual responsibility, that's how Governor Romney referred to it, has now become anathema, unthinkable, unconstitutional. Now, I can imagine that some people have undergone a philosophical process of rethinking those ideas. And so we do have a philosophical disagreement in the country. But there is also a political fact that the individual mandate became unacceptable the moment President Barack Obama embraced it. And the political divisions have followed an unfortunately unhappy course. I don't know what the result is going to be when the Supreme Court reaches its decision. Of course, I don't know what the result will be of the election in November. Perhaps we're going to go on fighting on this question. Perhaps it'll be another 100 years. It's astonishing. I would never have thought that years ago when I first got interested in it. It's a terrible prospect. But at this moment, there is a kind of shadow over this long effort to establish universal coverage. And whether that shadow lifts, whether we finally get to the destination, I can no longer be confident about.